the surgery for colorectal cancer is different between colon and rectal cancer. So starting with colon cancer, there's two types of surgery. There's an open surgery and there's a laparoscopic surgery. And there's actually been large studies that have shown that with a surgeon that's experienced in laparoscopic surgery, the outcomes can be equal. For either of them, the overall goal is to remove the cancer and remove several centimeters proximal, so before the cancer, and several centimeters distal or beyond the cancer in the colon, and then to reconnect the colon together. For the most part, people with colon cancer will be reconnected at the time of surgery. There are people who present where they've had their bowel obstructed and they may have a temporary colostomy, and later, several months later, the surgeon will then be able to reconnect. But for the most part, people are reconnected at the time of surgery to have normal bowel function again. For rectal cancer, the difference is because the rectum's in the pelvis, which is a more fixed structure, and there's a fair amount of muscles that control continence in there, the location of the rectal cancer depends on what type of surgery you have. So again, there are options to either have an open or a laparoscopic surgery for rectal cancer, but patients where there's a fairly low rectal cancer right near the muscles that control continence, some of those patients are going to require a permanent colostomy. So a permanent colostomy is required for certain people with rectal cancer, but still most people with rectal cancer fortunately don't need a permanent colostomy. But it's better to actually have a permanent colostomy than to be incontinent and not have normal bowel function.